Live real quick and talk a little bit about the COVID vaccine and COVID and everything like that. And I got my screens up here to kind of just walk through with you what we're seeing and where we're at. And if you're watching this and you find it useful, if you would just hit the share button because it would be really helpful if more people could see this. What we're going to talk about today is the state of the pandemic. A year in now, right after Easter, last Easter, I was like, well, people probably shouldn't get together. And then, by May Day, we'll all be back to normal. And boy, that was wrong. But we are really close to the finish line now. And that's going to be the take home message, and that we're getting flush with vaccine. And in a month or two, we're going to have vaccine available for everybody that wants it, that's an adult. And we're going to be in a much better place. So, my message today is there's a lot of hope to be had. There's a lot in the news and things about variants and all sorts of things, but we'll just talk through that. So the first thing that I want to do, I just got to make sure my screens are looking right, is look at covidactnow.org, and the right down here towards the bottom, it tells you the website address and everything's like that, and you can see what's going on around the country. So I look at this about every day or every couple days just to see where things are at, and things are kind of bad in some parts of the country. What we know now is the B117 variant, the one that was first out of the UK, has come to the US, and it's the predominant variant. The problem with it, what we know is that those that get B117 are more likely to end up in the hospital, and it's more transmissible. And the thought is that it might be more transmissible in school-age children, in athletic events and things along those lines. So we're not out of the woods yet. And the only saving grace that we have, that things aren't going to get dramatically worse in my experience and expectation from what I've read and listened to and watched and talked with experts about, is I don't think we're going to get there because of the vaccine and the fact that those that are at highest risk are getting vaccinated. And we just need to continue that push to get more people vaccines, and we'll be continuing to be in a much better place. We'll face this variant much better than other places around the world who haven't been able to get the vaccines available and rolled out with the speed that we have in the last 3 or 4 months. So if you look, Michigan is having a really tough time right now. New Jersey, New York, their rates are climbing, and there's lots of talk about the reasons why for this. Opening up of the activities and loosening restrictions and all those things certainly play a part. And then just the variant B117 is more transmissible, so we expect that it's going around more. And the hope is that even though it's going around more, that the hospitalizations and deaths will remain lower than the terrible time that we had in November, December, January. Because more people are vaccinated, and those that are at high risk for disease are vaccinated. And so if we zoom into Nebraska here and see, what you'll see is everybody 16 years and up is eligible, which is amazing. And then it breaks it down by county where we're at. So Douglas County, actually this is broken down. Let me change this. Oops. Cherry County, Nemaha, Boone County, those are ones that are having higher rates right now. And then there's some that are at higher risk. So Douglas County is climbing, is 32 cases per 100,000. Remember, we would love to be like below 5 cases per 100,000. When we were at our peak, we were around 100 cases per 100,000. So we're certainly making our way up there. Lincoln has held steady down at 14. But we're still in the thick of it, and we're still having cases, and we're still testing people. We still got our tent up in the parking lot where we're doing swabs and everything like that, and having some positives. Here's what you can see what things have been like in the past. Here's where we got, this was terrible. In November, right before Thanksgiving, 121 cases per 100,000. Now we're down at 22.6, which is actually just as high as last summer when we were saying, lock down all of the different measures that we were doing. What's the difference in the message between here and here? We know what works. Masks and social distancing work best to prevent the spread, and we have vaccines on board. And those are the two biggest saving graces that we have. And by and large, everyone has been able to do masks. There's obviously the exceptions and everything like that. But I go to the grocery store, everyone's wearing a mask. Not a big deal. At schools, everyone's wearing a mask. I hear from kindergarten teachers, first grade teachers, the kids are all fine wearing masks. It's not a big deal at all. We've been able to keep kids in school, which is so much more important than trying to do a whole year of Zoom school. And I feel so bad for those around the country whose children have been at home for this entire year and are going to end the school year again not in school. That just needs to change. That cannot continue for anybody's sake. But what's the difference between May 9th when we were at 21 cases and of May 9th, 2020 and April 5th of 2021, the vaccine, and we know what we're doing much better now in terms of wearing masks, limiting small social gatherings where people are close together. Those are where the outbreaks are still occurring. And now we have the vaccine available, and so we're going to drop. We're not going to get back to this point. And what we're going to see is probably it comes up a little bit, vaccines continue to roll out, and then hopefully things just continue to improve from there. So hopefully that makes sense in terms of kind of where we're at with the pandemic right now. Around the world, they're in a much worse place than us, and so we should count our lucky stars that we are here and we've been able to weather this storm so much better than in other parts of the world. Having the vaccine available has made the biggest difference of all, is why we're not back up here right now, because a large portion of the severe at-risk people are vaccinated. And so we're not having the death rates and the hospitalization rates that we were when things were here, and it was really scary. Now, I want to shift attention to what to do now. We have had a really robust response from our local health department, everyone in our city, our mayor. Everyone has been doing an amazing job, along with all the healthcare workers and essential workers and everything like that for Lincoln. And they just came out with something just this week that I wanted to put some light upon, because it's a really cool resource for those that are trying to find a vaccine and trying to know what to do. It's LNK, like Lincoln, the airport abbreviation, lnkvax.com. And if you go there, this is what it looks like. And it says, get registered, get the vax, get ready to make a comeback. And then they have all this great, well-produced YouTube video that the comeback starts with you, and it talks about getting ready to come back to a healthier community, getting ready, getting inspired, and realizing that we're almost there. And then what I really like, there's all these resources and posters and graphics and myth-busting sheets, which is helpful, I think, when talking to loved ones that aren't sure if the vaccine is right for them. But then the two things that are really helpful, one is you can click register today for your spot, and then it will take you to the City of Lincoln page where you can register and get notified when you're available or ready to get a vaccine from the local health department. At the Max vaccine clinics, where they're doing like thousands and thousands and thousands of doses per day, and it's been super organized, and I love getting to see the response from the community and the volunteers and everyone turning out to help in all those ways. And you just sign up right here, and then you get notified when it's time, when your turn is up. The other great thing, which we actually used at our house to find my wife a vaccine, was this Find a Pharmacy button. So if you go here, it goes to vaccinespotter.org. There's also a really good Twitter handle that updates like every 5 minutes where vaccines are available. It's at NE vaccine alert, and they update that. But this links you to vaccinespotter.org and to the Nebraska page, and then you can look and actually see where appointments are available. You can put in your zip code, you can put in how far you're willing to travel. We went to Omaha to get my wife's dose, and then we went to the zoo while we were up there. And then all of these appointments available spots, you can actually click through and see, okay, what's available in my community, or where am I willing to drive, or whatnot. And then it connects you right to the Walmart website, to the Hy-Vee website. Those are the main two places. And then there's a couple like local pharmacies like Rely Care and Kohl's in Lincoln as well that are doing it. But this is the place to find your dose. And it's super easy to book a spot when you know, okay, if I look on Hy-Vee, I need to go to the Shadron Hy-Vee or the Omaha Hy-Vee or the South Lincoln Walmart or the Beatrice Walmart, wherever it is. This website is fantastic, and if you just all you have to remember is lnkvax.com. That will take you right there. So hopefully this is helpful information for you. The vaccine is safe, it is effective, it gets the job done, it's lowering hospitalization rates, it's keeping our community safe, it's allowing things to reopen so our economy can get back to normal and people can get back to work and stay in school and stay healthy and everything like that. So I would just highly recommend looking at all that information, going to lnkvax.com to learn more, keeping up to date, and realizing that we're so close to the finish line, and we're not going to be doing the same stuff in the fall that we were doing right now and what we were doing last fall. It's going to be a totally different game as more vaccine gets available. Now I know there's questions coming in about children. No information other than that 16 and up can get registered and do it. What we've seen is that there's been a lot of studies that are starting to come out, and if you keep a look on my Instagram, if you look on my Facebook page, those are places where you can find information. As I learn more, I will certainly share more information about the COVID vaccine for children. The studies they've done, the mRNA studies for the Moderna and Pfizer vaccine, safe and effective in kids 12 to 15. So I imagine that in the coming weeks, that will be something that opens up, and then we'll figure out how to get those doses into arms. Locally here in Nebraska, the your own doctor isn't getting those shots, so we're not able to, have you come to the office and get the dose. We're sending people places if their child is eligible, and so unfortunately we can't give it in the office like we are used to, and where you have kind of established that medical home. Hopefully that will change. If you have any power or sway to make that change, make that change, because people want to come where they know people, and we already have the infrastructure. We did a flu clinic outside last fall where it was a drive-through flu clinic, and we gave like 500 doses in like 2 or 3 hours, or even more, and people just loved it because all you did was swing around. Kids were in their car seats. They didn't mind. They just got their vaccine and went on with the rest of their day. And so we have the ability to do that. We don't have the permission to do that or access to the vaccines yet, but hopefully that will change so that we can start giving those in the office as we get it approved, as it's shown to be safe and effective in younger age groups. And I think that's just something that we'll continue to watch and learn about and keep up to date on. But we know that children are less likely to get severe disease. We want to protect those that are at highest risk first, and then work our way down from there, knowing that children are very unlikely to get severe disease. They certainly can spread it. There's some thought that the B117 variant is spread more easily in kids too, so it's not something that we're completely out of the woods yet, but we're getting closer. And what I would love for you to do is hit the share button if this has been helpful, and share it to your people that are in your network. You can hit the like button, you can comment below, you can hit share and share it to a group if there's a specific group that you think would benefit from it. But getting that information out there, getting to lnkvax.com is the best way to just like find your dose of the vaccine. If you want to keep tabs on how things are going, it's covidactnow.org. That's the one that is updated frequently, and it's got all of the information, and you can look and see how things are going for relatives in other parts of the country. Keep up the good work. We are truly almost there. I don't remember if I said that before. I don't know if I've said that before, that we're almost there. I've said that we're at the beginning of the end, back when the vaccine came out and all those things. And now we are at the end of the end. It's just a little bit more time to get that vaccine out to everybody. And we're almost there, and it's going to be, a month before. Well, you don't need this website, Vaccine Spotter, because you can just go to Hy-Vee or go to Walmart or go to your doctor's office and get the vaccine. That's where we're going to be at in a month from now, and it's going to be fantastic. So keep up the good work. Hopefully this was helpful.